Esteemed members of this committee who are showing me how stalwart Mainers really are. Like, wow. I've been sitting here a long time. My name is Dr. Christiane Northrup. I'm a board-certified OBGYN physician. I worked at Maine Medical Center for 25 years, was also a clinical assistant professor of OBGYN there. I'm the author of a bunch of books, several New York Times bestsellers, and I was on Oprah 10 times as a whatever I was, an expert. I am here to oppose LD798. First thing, it's abundantly clear that Maine has a very high voluntary vaccination rate, 95% at least. The concept of herd immunity only applies to natural immunity, and it's a pre-vaccination era concept. It was borrowed by the public health community, but it has never really been proved. So this herd immunity concept, really, we're using it very, very loosely because it only applies really to natural immunity within a community. The measles, there hasn't been a reported case of measles in Maine in 17 years, with the exception of one Canadian visitor that was already mentioned, and that person left before making sure other people got measles. Measles, this is very important to realize. Measles was on the decline, dramatically on the decline, before the vaccine was really introduced. So let me give you some stats on that. The measles death rate in the United States averaged 10,000 people per year between 1910 and 1920, and I believe that there's a collective unconscious fear of contagion, like smallpox and all of that stuff. And then the number of measles deaths declined from 7,575 in 1920 to an average of 432 each year from 1958 to 1962. The vaccine wasn't introduced until 1963. Other childhood diseases, such as polio and whooping cough, were also on the decline before vaccines were introduced. And the reason, which has already been suggested, is better sanitation, nutrition, other public health measures. Between 2005 and 2014, there were no deaths from measles in the United States. There were, however, 108 deaths from the MMR vaccine, according to the Vaccine Adverse Event Reporting System, which you've heard about. Based on the VAERS database reports and population studies, there is a risk of death, hospitalization, and other serious adverse consequences, not to any particular vaccine, although you've certainly heard those testimonials from a particular vaccine, but rather to the total number of vaccines given both simultaneously at the time of the visit and cumulatively over a patient's lifetime. And what you heard from Meryl Nass is the truth as I have researched it, and that is that in 1986, when Congress made vaccine companies completely immune to litigation, the number of CDC-recommended vaccines tripled, and there's at least 200 more in the pipeline. So that's part of my problem with the vaccinations, is that every time you turn around, and my editor at Random House edited the American Academy of Pediatrics recommendations, and she said, starting in the late 1980s, she said, I can't keep up with this. Every time I turn around, I've got to revise the book. There's more and more and more added.
Dr. Northrup, I need to ask you to wrap up, please.
Yep, okay. So, main thing, the vaccines themselves, in all the vaccine outbreaks, a huge percentage of the vaccines, of the cases, were in people who had been fully vaccinated. You're never going to get rid of measles because the vaccines themselves can give people measles. That's already been stated. We have viruses that are secreted by those who have been recently vaccinated for up to a month or 7 weeks. Thank you.
Thank you. Are there any questions? Representative Sampson.
Thank you, Madam Chair. Thank you so much for being here, sitting patiently. You have stick-to-itiveness as well. My question for you is, why do you think there's the measles outbreak that's occurring now?
Because the vaccine itself gives a kind of fake immunity. It's not the same as lifelong immunity that you get from having the disease. When you've had the disease, you got lifelong immunity. But the vaccines we're finding, like the mumps outbreak at Harvard, all those kids had been immunized against mumps. So the problem that we have is that the vaccines do not give the same immunity, and there's evidence that we're actually messing with people's immunity. So that's why the number of chronic diseases in childhood, which is the real issue, has doubled or tripled in the last 20 years, and that's the real public health problem.
Senator Carson.
Dr. Northrup, the articles that I read about the Washington State measles outbreak indicated that a very, very high proportion of those folks, I think most of whom were children, had in fact not been vaccinated. Did I misread something there?
I haven't looked at those studies in the articles that I've sent you. Those are other studies. For instance, a Dallas school had a very, they were very well vaccinated, almost 99%, and they still had measles outbreaks. I've given you that study.
Right, but you haven't looked, then you haven't
I have
looked
not.
at what you
But in China, they also have measles outbreaks, and they're all vaccinated.
If you would like to get back to us with the data on the Washington State study, that, or we can ask our own CDC, but that would be helpful because
Okay.
that was prominently featured that.
Okay.
Representative Rudnicki.
Thank you, Madam Chair. What would you say to those who believe that an unvaccinated child poses an undue risk to children that have the immune compromised?
Yeah, what I would say to them is that it looks from the data that the people who've been recently vaccinated are far more of a risk than an unvaccinated child. Many, many people in this room and in the state of Maine, like me, are extraordinarily interested in good immunity that you get from vitamin D, vitamin A. There's studies from South Africa that in hospitalized children with measles, the death rate was cut in half by giving the children vitamin A. So there's huge nutritional things we can do. There is not universal vulnerability. There just isn't. And I think we need to take a look at the individual cases because, it's like with Lyme disease. Many, many, many of us in Maine have been bitten by a tick. Very few of us actually come down with real Lyme. Yeah.
Senator Pouliot.
Thank you, Madam Chair. Thank you, Dr. Northrup. A couple things. Why has the CDC's schedule doubled, or appears to have doubled since the 1980s in terms of vaccines that are required?
Well, if you're in business as a pharmaceutical company and you have all liability removed and everything's mandated, wouldn't you as a business person just say, man, let's just see what we can do with this? I mean, the amount of money that the pharmaceutical industry makes on vaccines has just skyrocketed. And I wish that this weren't the case, but to me, it seems so obvious. No liability. I mean, if I had a business like that where every government mandated it and I had no liability, don't you think that there might be less of a incentive to really make sure that everything was absolutely safe?
Why do you think sometimes in government people are suspicious of corporations and want to go after big corporations and attack them, but when it comes to vaccines, there's seems to be a reluctance to dig deeper? It's just a doctor said that this is good, so it has to be good. Or, I mean, you're a doctor. I'm just a layperson up here. I'm a real estate agent trying to figure this out.
This vaccine thing almost takes on religious connotations. If when you've heard the people here in Maine today, right? If you take your baby in and they suddenly have seizures and they get encephalitis, you've heard from the parents here. They have to fight to be heard. My whole career has been based on actually listening to my patients. They tell me what's going on. When it comes to vaccines, it's like this is the holy of holies, and we just can't seem to get it. that these things need to be investigated more. It's sacrosanct. We had a guy in my residency, it reminds me of this. He had written the marriage manual for Catholics, and he had a ring that the Pope had kissed. He did not take off his ring to scrub for surgery, even though we know you got to take off your ring because that's going to harbor bacteria. But at St. Margaret's Hospital for Women, this guy, because the ring had been kissed by the Pope, he didn't have to take it off when he scrubbed for surgery. It feels like this is the same.
Okay, Representative Drinkwater?
Thank you, Madam Chair, and thank you, Doctor,
Thank
for
you.
coming in.
Thank you very
We've
much.
been hearing this evening about adults' immunizations expiring. Is that a real concern, or is that just a rumor? And second of all, Ellis Island used to be a great place where they would quarantine people that were immigrants. We seem to be hearing now that these people coming in from other countries and bringing these diseases. Is that something that we really need to be concerned with?
I'll tell you my biggest concern, and that is that pretty soon, the way it's going, I'm going to have to get a flu shot to get my driver's license renewed. I am terrified of that. No, I'm serious. So I think that that's a concern, but if everyone's replete with vitamin D, vitamin A, then these things don't need to be so worrisome. Yeah.
And could you just touch on the adults? Because we've heard testimony that, adults should be vaccinated also,
What I'd
updated.
like to see with adults is to have titers drawn. I've heard from many, many people that they won't draw a titer. If you came of age before the 80s, chances are very good you had measles, you had chickenpox, you're immune for life. I would want titers drawn before you just universally mandated vaccines.
Representative Sampson?
Thank you, Madam Chair. I'm really appreciative that you're here, and sort of to Senator Pouliot's point, I'm kind of curious because you're writing and you're out there
Yeah.
with this information.
Yeah.
What can you speak to, and I know it's a little bit divergent off this bill, and I'm going to get thwacked by somebody, but I like to live on the edge. The censoring of the social media around this issue.
This is insane to me.
I told you.
Absolutely insane. That wonderful Mainer her family had been here since 1620, she said, are we headed for the Crystal Night? When all the books were burned? I mean, this country, especially Maine, is about independent thinking. And the censoring of social media, to me, makes no sense. Why would Jeff Bezos and why would the other guy, Zuckerberg, even do this? I would imagine they would say to the government, look, we're an independent, we were an independent company. Let 1,000 lotuses bloom. This business about those of us who question vaccines being anti-vaxxers, ignorant people who don't know the facts, that were taken in by hucksters like me, okay, frankly, because I happen to have a big social media thing. I mean, it's awful that my daughter in New York City can't simply post anything on Facebook where she says, I think we're being kind of snobby about this. Can't we?
I do want to bring us back down
Yeah,
to the
okay.
bill again,
Anyway,
please.
there you go.
Okay. Any other questions? Senator Pouliot, you have one final question.
Thank you, Madam Chair. So I guess, could you just summarize what is the largest, what do you feel is the biggest risk, health risk to Maine kids?
Childhood obesity, ADHD, diabetes, that kind of thing. That's and crappy food. That is the biggest risk to Maine kids, by and large. Yeah.
Thank you very much for your testimony.
Okay, thank you.